All right, today we're going to dive into those strange, sometimes maddening sensations that can pop up in our hands and feet. It's a problem of sensation that a ton of people deal with, but it's often a real mystery.
Ever had that weird pins and needles feeling that just doesn't quit? Or a numbness that makes simple things like buttoning a shirt feel impossible? Or maybe even a really sharp, burning pain that's triggered by something as gentle as bed sheets? If any of that is ringing a bell, well, you are definitely in the right place. You see, these feelings aren't just random glitches. They are very specific signals from your body's internal wiring. Think of them like warning lights on your car's dashboard. They're telling you there might be an issue with your sensory nerves, the ones for touch and heat, or even your motor nerves, the ones that make your muscles move. So the official name for what's causing all these signals is peripheral neuropathy. Let's really break that down and decode what's actually happening inside your body when these signals get all mixed up.
Okay, so just imagine for a second that your body is run by this huge, incredibly complex electrical grid. That's basically your peripheral nervous system. It's this amazing network of nerves that starts at your brain and spinal cord, that's your central hub, and branches out to connect to literally everything else. Your arms, your legs, your organs, your skin. It is the communication superhighway for your entire body. And if we zoom in on that grid, we see the building blocks. Every single nerve is made up of these cells called neurons. See that long fiber? That's called an axon, and it acts just like an electrical wire. And just like a wire, it needs insulation. That protective coating is called the myelin sheath, and it's what helps the signals travel super fast and efficiently. So here's the bottom line. Peripheral neuropathy is what happens when those wires, the peripheral nerves, get damaged. Maybe the insulation phrase or the wire itself gets broken. When that happens, that critical line of communication between your brain and the rest of your body, it gets staticky, it gets disrupted, and that's where all those strange signals come from.
And this nerve damage generally shows up in two main flavors. On one hand, you have polyneuropathies. Poly just means many, right? So this is when lots of nerves are affected, usually on both sides of your body, kind of symmetrically. It's the type you often see with conditions like diabetes. Then on the other hand, you've got mononeuropathies. Mono means one. This is damage to just a single nerve, usually from something specific like an injury or doing the same motion over and over again. So now that we have a handle on what it is, let's take a closer look at the actual warning signs your body sends out when these nerves start to misfire. The symptoms really fall into two big buckets. First, you have the sensory symptoms. That's the tingling, the burning, the numbness we talked about, and that crazy sensitivity to touch. Then, you've got the motor symptoms, which mess with your movement. We're talking muscle cramps, weakness, twitching, and even balance issues, because your brain isn't getting clear messages from your feet. And here's something really important to keep in mind. Sometimes the symptoms can look a lot like other conditions. For instance, poor circulation can also give you cold feet and a cramping pain in your calves called intermittent claudication. That's basically pain that shows up when you walk and goes away when you rest. It can feel a lot like neuropathy, which is exactly why getting a proper diagnosis is so important. Which of course brings us to the next big question. If you're going through all this, how do doctors get to the bottom of it? How do they find the actual source of all that static on the line? Well, the good news is the diagnostic journey is usually a very logical, step-by-step process. It always starts with the basics. Your doctor will want to hear your whole story, your medical history, and do a physical exam. After that, it usually moves on to blood tests to check for underlying causes, and then, if needed, some special studies that measure your nerve function directly. So, what are they hunting for in those blood tests? A few key culprits. They're definitely going to check your glucose and A1C levels, since diabetes is such a common cause. They'll also look at your vitamin levels, especially B vitamins, which are absolutely crucial for healthy nerves. And they'll check how your thyroid, liver, and kidneys are doing, because problems there can also trigger neuropathy. And that final step involves these nerve function studies. Now, I know the equipment might look a little intimidating, but these tests are incredibly revealing. One is called a nerve conduction study, or NCS, and it measures how fast signals are zipping through your nerves. The other is an EMG, which checks the electrical activity in your muscles. Putting these two together helps doctors pinpoint exactly where the damage is and just how bad it is. So once a diagnosis is made, the whole game shifts to management. And this is a really important mindset shift. For a lot of types of neuropathy, the goal isn't really a cure in the traditional sense. It's about gaining control, managing the symptoms, and getting your quality of life back. This quote from our source material just says it all, really. There's no single magic pill that fixes everything. Instead, managing neuropathy is all about creating a comprehensive plan that's tailored specifically for you. Now, that plan often does include medication, and it might sound a little strange, but some of the most effective drugs for calming down nerve pain are actually medicines that were first developed as anticonvulsants or antidepressants. They just happen to be really good at quieting down those overactive nerves. Things like topical creams or patches can also give some great localized relief. And in some really specific situations, especially with those mononeuropathies where one single nerve is getting physically squished, surgery can be a fantastic option. The classic example is carpal tunnel syndrome. A surgeon can go in and release the tissue that's pressing on the nerve in your wrist, and that can bring a huge amount of relief.
But listen, medication is only one piece of this puzzle. A really effective plan looks at the whole picture. We're talking physical and occupational therapy to keep you strong and functional. We're talking big lifestyle changes, eating well, getting regular exercise, quitting smoking, and cutting back on alcohol. And if you have numbness in your feet, daily foot care becomes non-negotiable to prevent injuries you might not feel.
And finally, a lot of people find real relief from complementary therapies. Things like acupuncture or TENS units that use a gentle electrical current to interrupt pain signals. These can be really powerful tools to add to your toolkit, giving you more ways to control your symptoms. You know, figuring out how to manage neuropathy is definitely a journey. It's not a final destination. It's all about taking back control one small step at a time. So the question I'll leave you with is this: what's the first small step you can take for your own nerve health starting today?